All right. Well, good afternoon, everyone. Thank you so much for joining us. We're so glad that you are here. For those of you that are new to our community, we are SMB Financial Strategies and Green Bee Advisory. We are a boutique independent wealth management firm that leads with comprehensive financial planning and advice. So we believe in building long-term relationships with our clients and also supporting our clients in every area that contributes to a meaningful and well-lived life. So hence the topic for today's webinar. And today's webinar is actually part of our Finovate program, where we host both in-person and virtual meetings throughout the year that are designed to bring value to our clients as well as those that are in our community. So we believe that health is really an important part of your overall wealth, and financial success really means very little if you don't feel well enough to enjoy it, right? So that's why we are especially excited to welcome Dr. Solmaz today. She is going to share her practical, science-based approach to using food and lifestyle strategies to support weight, energy, and long-term wellness in a way that's sustainable and realistic, because that's obviously also very important. So, Solmaz, we're very grateful for you for being here with us, and thank you for all of you for joining us virtually as well. And we hope that you leave with insights that you can start using right away.
Thank you so much, Sarin. Thank you for being here, everyone. And I want to thank Catherine Belega of Green Bee Advisory
I
and
can see
Sarin.
Theron's talking. I can't hear a word they're saying. The video's on, the display is on.
You can't hear me talking? Oh, should I just keep talking or?
Yeah, I would keep going.
Okay. So I want to thank Sarin of SMB
No,
Financial
I'm not
Strategies
muted.
for having me
Hi.
today.
Can you guys hear me?
Yes.
Yes, we can hear
I
you.
can't hear a word you're saying.
Yes, we can hear you.
Go over to mute. There's a
You may
pull
need
down
to
on
change
the other
your
side.
audio
Or the
source.
volume up,
Make
maybe.
like
I
a
don't know if your
speaker.
volume is down.
Try speakers, real deck audio.
This?
See. No.
I just
Oh,
chatted
wait.
Allison, so we can.
I can hear you now.
Oh, great.
Okay,
Sorry.
that's okay. So I'm Solmaz Amirnazmi. I'm a board certified lifestyle medicine doctor. I'm a weight loss coach and I'm a mom of two. And today we're going to talk about something incredibly empowering. And this is the idea that you have so much more control over your health than you may think or you may have been led to believe. We're going to talk about inflammation. We're going to talk about weight, about energy, about balance, about long-term vitality. But before we get into science, I want to tell you why this matters to me personally. I know firsthand what it feels like to lose control of your health. After I gave birth to my daughter, I suffered a life-threatening postpartum hemorrhage. I lost half of my blood supply and my iron levels dropped from high normal to nearly zero. The months after delivery were some of the hardest of my life. I was weak, I was dizzy, I was short of breath, and I essentially had a non-existent breast milk supply. Emotionally, I felt sadness and I felt guilt. I tried so hard to breastfeed. There was so much pressure to breastfeed. The culture at the time was pushing women to breastfeed. So if you weren't doing that, you were made to feel that you weren't doing a good enough job to be a mom. And from the moment I gave birth, the lactation consultants flooded the room. I was pumping my breast for hours, nothing was coming out. And I had absolutely no one to guide me on this, not the OBGYN, not my primary care doctor. And I felt shame and I felt inadequate. Eventually, like after thinking about it with my doctor brain, I was like, maybe we should get a ferritin, which is basically your iron stores. I wanted them to be checked. And when they checked them, they were near complete depletion. And then I realized, oh, I think maybe the reason I have no breast milk supply is because I have no iron. You need iron to produce breast milk. So my hematologist recommended iron infusions. And thankfully, I was stable enough that I was able to choose an alternative lifestyle-based path. So under medical supervision, I chose to focus aggressively on rebuilding my hemoglobin and my iron stores through nutrition and through food as medicine. So I really embraced iron-rich foods like vitamin C pairing, anti-inflammatory meals, balanced macronutrients. This was a plan that I strategically put together myself since I had food as medicine training. And at my 3-month follow-up, my hematologist was totally shocked because my iron levels were climbing without the infusion therapy. And that was really a pivotal moment for me because it confirmed to me that our bodies, that my body, had this extraordinary ability to heal when it was supported properly. But there was another big piece to my story. Because my focus was survival and rebuilding my blood supply, I wasn't thinking about my weight at all. I hadn't been cleared for exercise yet. I was totally exhausted. I was in recovery mode. And I gained more weight than I ever had in my life. I felt heavy. I felt slower. I felt frustrated. And I felt depleted and just generally unwell. And on top of that, I had to return to work as a full-time internist and was expected to perform as if none of this had happened. The expectation was to perform perfectly at work and perform perfectly at home while feeling absolutely miserable. I felt like a failure as a mother for not being emotionally present and unable to provide breast milk for my newborn. I felt uncomfortable and unsexy in my skin and my clothes. I felt physically unfit. I felt short of breath with minimal activity, like just climbing the steps. And I was totally frustrated over my state, wondering, is this the new me? Is this my new baseline? This was my low point. I recognized, though, that the reason I felt this way was because of how important it was to me that I was a good mom, that I was a good wife, that I was a good doctor, and that I was in good enough health to be able to be all these things. So these emotions catalyzed me to act and to take back control of my health, using all of my knowledge, using my skill, and using my experience. I wanted my whole self back. I didn't just want the normal labs. I didn't just want to be in survival mode. I wanted vitality. So I created a plan, one that allowed me to restore metabolic health, to lower inflammation, to lose weight sustainably, and still enjoy the foods that I love to eat without extremes, without depriving my body, without these fad or gimmick diets. And as the weight came off, something even more important happened. My energy came back, my mood improved, my confidence returned. And the most beautiful part was that my family came along for the journey. Our daughters became excited about cooking healthy meals, outdoor adventures became normal, healthy living became a shared value. So the transformation wasn't just physical, it was generational. And I'm sharing all this because my story, it's not because it's unique, it's because it's not unique, because so many of us find ourselves in a season where our health feels like it's not in our control. This led me on the path to create my lifestyle medicine coaching practice to offer the support and the structure that I desperately wished was available to me on my journey to whole health. So I want to take a step back and tell you a little bit about how the traditional medical system is designed, because it lacks the structure and it lacks the training to develop a doctor that could have helped me at my low point. During my medical training and early career, I was caring for everyone else. I was working really long hours, feeling extremely overworked, high stress, poor sleep, poor nutrition, grab and go meals. I was teaching patients about nutrition and exercise, and I was barely practicing it myself. And I had to ask myself a very difficult question, which was, how can I expect my patients to live in alignment with health when the system doesn't even support doctors in doing so? And that was really uncomfortable for me, but also clarified a lot for me, because I realized this wasn't just about will, it was about having the right structure. It was about having the right environment, the right systems in place, the right support. And that question changed my trajectory. So as a primary care doctor, the majority of what walked through my office every day was preventable. High blood pressure, type 2 diabetes, obesity, fatty liver, heart disease. And I kept thinking, we're waiting for people until they're sick enough to need meds instead of intervening early on. When we know an individual's genetic predisposition, we know their risk profile, when the first warning signs appear, why are we not intervening sooner? What if we intervened earlier? What if we addressed the root cause before disease fully developed? Because the truth is, if you're like most people, you may have some habits that are quietly increasing your risk for illness and not even realize it. But the good news here is that there's something that we can do about it, because even just like simple changes within weeks can dramatically improve our overall health and our overall happiness. Our healthcare system was built to treat disease after it develops. But the data shows us that 80% of heart disease, stroke, and type 2 diabetes, and 40% of cancers are preventable through improvements in diet and lifestyle. This is what the data tells us. This means that prevention should be foundational. It should be our responsibility. And the most remarkable part of this is that this approach is the least expensive. It has no negative side effects, and there isn't a medication on the market that can promise this. So I became fascinated with the science of root causes, not just diagnosing and treating, which is how I was trained in internal medicine, but asking, why is this happening in the first place? How can we intervene to prevent this process in others and reverse the progression of disease? And that's when I pursued board certification through the American College of Lifestyle Medicine and immersed myself in evidence-based lifestyle medicine. So what is lifestyle medicine? Because a lot of times people will ask me this. I wanted to talk about this for a moment. It's a board certified medical specialty, and it focuses on using therapeutic lifestyle interventions to prevent, treat, and often reverse chronic disease. Instead of asking, what medication can I add? It asks, what root cause can we address? It's structured, it's evidence-based, and it's very powerful. And it operates through 6 pillars, which you see right here. So these 6 pillars are a framework for improving health outcomes by addressing root cause instead of looking at symptoms. So I'm going to briefly walk you through them. Number 1 is nutrition, and it's emphasizing a whole food, predominantly plant forward pattern, rich in vegetables, fruits, whole grains, legumes, nuts, seeds. This pattern supports heart health. It supports blood sugar balance, weight regulation, and lowers chronic disease risk. The second pillar is physical activity, which includes regular movement, aerobic exercise, strength training, simply reducing sedentary time. We generally recommend 150 minutes of moderate intensity physical activity weekly, plus strength training. That's a very important piece, the strength training. The third pillar is restorative sleep. It is foundational because poor sleep is directly linked to obesity, to diabetes, to cardiovascular disease, and impaired immune function. The fourth pillar is stress management, and this matters so much because chronic stress drives hormonal disruption and inflammation. So we use techniques like mindfulness, like breath work, and cognitive strategies to improve resilience. The fifth pillar is social connection, which is foundational. Strong relationships are associated with lower chronic disease risk and longer lifespan. And finally, the sixth pillar, which is avoidance of risky substances like tobacco, like excessive alcohol, recreational drugs. By avoiding these, you dramatically lower your disease risk and your premature mortality. And it's important to note that these pillars work together. They're synergistic. So when you practice them like that, they create an exponential benefit. So through both my research and clinical practice, I have come to see a consistent pattern. The common denominator linking most chronic conditions, from type 2 diabetes and cardiovascular disease to neurodegenerative disorders and even obesity, is chronic inflammation. And so I want to spend some time talking about different types of inflammation because not all inflammation is bad. Acute inflammation is actually great. It's a good thing. It's your body's natural healing response. You cut your finger, inflammation brings immune cells to fight the infection. You sprain your ankle, that swelling that you see, that redness, the heat, there are signs that your body is healing, it's repairing tissue. Acute inflammation is protective, it's short-term, it's necessary, and it's exactly what your body is built to do. The problem comes when inflammation becomes chronic. It's low grade, it's persistent, it's silent, or the symptoms are not quite obvious. It's just very sort of, fatigue, or just, feeling not like when somebody comes in with chronic inflammation, a lot of times it's not obvious what's happening. This is chronic inflammation. It doesn't turn off. It can quietly damage your blood vessels, your fat tissue, your joints, your brain cells, and your metabolic pathways. Chronic inflammation is what drives the majority of chronic illness. Obesity, type 2 diabetes, cardiovascular disease, autoimmune disorders, even neurodegenerative diseases. So just to summarize, acute inflammation is helpful and it's finite. Chronic inflammation is oftentimes silent, it's damaging. And very important takeaway here is that inflammation doesn't just cause disease, it also drives weight gain. Visceral fat itself actually secretes inflammatory molecules. And visceral fat, let me just back. So visceral fat is the fat that surrounds our vital organs, like our colon, like our liver, our gallbladder, our spleen. Like when we talk about reducing waist circumference, we're talking about lowering that visceral fat, because what's happening is the visceral fat secretes inflammatory molecules, and that inflammation leads to fat storage. That fat storage leads to more inflammation, and then that leads to metabolic dysfunction. So this is exactly why, in order to achieve sustainable results, sustainable weight loss, lower blood sugar, improve blood pressure, and so forth, we need to lower inflammation at the root. And that's where the ENSO method, rooted in evidence-based lifestyle medicine, comes in. Everything from stubborn weight gain to cardiovascular neurodegenerative risk is connected to chronic inflammation. When we understand this, it changes the question from how do I lose weight to how do I lower inflammation, restore metabolic health, and support long-term wellness. This is what guides the ENSO method. So we've talked about the 6 pillars. We've talked about inflammation as the common denominator. So the question is, how do we lower it? Because this isn't about short-term dieting. This is about really changing the biological terrain. Inflammation is not caused by one thing, and it's not fixed by one thing. It is multifactorial and requires as such a multi-pronged approach. We lower inflammation through what we eat, through how we move, how we sleep, how we regulate stress, our gut health, environmental exposures, and even our social connection. These are all pillars of lifestyle medicine. But in my clinical experience and in the literature, food is the most powerful lever. And why is that? Because we make that decision multiple times a day. It directly impacts blood sugar, insulin, gut integrity, oxidative stress, even the way our mitochondria function, and inflammatory signaling pathways. Food is information, and it's the fastest way to shift our internal environment. So while we absolutely need to address sleep and stress and movement, I practice a food first philosophy, because when we get food right, everything else becomes easier. So when we look at the research across decades, across populations, one dietary pattern consistently rises to the top. This is the Mediterranean style dietary pattern, and it's not a diet at all, actually. It's not a fad or a cleanse or a short-term intervention. It's a sustainable way of eating for life. It's a heart-healthy, plant-forward eating pattern inspired by countries bordering the Mediterranean Sea, and it's been shown to lower your risk of cardiovascular disease, to improve metabolic markers, to lower inflammation, to lower neurodegenerative risks like Alzheimer's, Parkinson's, and support healthy weight management as well. And the most important thing is, I think it's delicious, which matters because sustainability requires pleasure. In order to keep doing something, you have to enjoy doing it. So as you can see here, this is the traditional Mediterranean diet pyramid, and it's emphasizing daily consumption of fruits, vegetables, whole grains, beans, nuts, extra virgin olive oil, with moderate intake of fish, poultry, dairy, and then red meat and added sugars are there in limited amounts. So why does this work? It works because it supports the biology of inflammation reduction. Fiber feeds the gut microbiome, and that regulates immune function. Adequate protein preserves lean muscle and supports metabolic rate. Healthy fats, especially like monounsaturated fats, omega-3 fatty acids, they lower inflammation. Colorful plants and spices provide polyphenols that act as antioxidants, and lowering ultra-processed foods lowers glycemic spikes and oxidative stress. It's not about counting calories, weighing food. It's about a sustainable lifestyle for the long haul. So during residency and beyond, I became very focused on studying different dietary patterns and how they impact the trajectory of disease, not just weight loss, but long-term metabolic outcomes. Like, how does this diet affect your cardiovascular risk? How does this way of eating affect neurodegeneration, even fertility, how long you live, how well you live, what patterns promote decline, what patterns promote resilience? And again, the anti-inflammatory whole food dietary patterns emerged as foundational. So I don't know if I should keep questions to the end, or if there's any questions, or just keep going. Maybe I'm going to keep going, and then I can see.
We can also tell people put their questions in the chat if they don't want to forget it, and we can get to it at the end.
Sure, that sounds great. So if you want to put your questions in the chat, feel free, and then I can address them at the end. I'm just going to shift gears a bit and tell you about my health philosophy, which is rooted in the sacred concept of ENSO. So in Zen Buddhism, Enso is the circle, which is symbolizing wholeness and enlightenment. It can be open, representing imperfection and growth, or it can be closed, which is representing completion and harmony. Each Enso is painted with one brushstroke. It's never edited, and it's meant to represent that exact moment. And that's how I view health. Not perfection, not extremes, just continual alignment and progress. The Enso method translates the science of inflammation and lifestyle medicine into a practical food-first method, but incorporates a multi-pronged approach using all pillars, integrating all of them to help you achieve your ultimate wellness and weight loss goals. So the Enso method is a root cause framework. I look at your entire profile, your past medical history, your genetic predispositions, your lifestyle habits, and develop a customized lifestyle action plan to help you achieve your health and wellness goals. We focus on stabilizing insulin and blood sugar, on lowering inflammatory signaling, building muscle to improve metabolic rate, and designing an environment that makes health easier. It's not just about what you eat, it's about how you think about food, about rewiring your mindset, redefining your relationship with nourishment, and replacing restriction with a structure. We focus on anti-inflammatory whole foods with a plant-forward approach, on adequate protein intake, on high fiber intake, on healthy carbohydrates, on beneficial fats, the strategic use of spices, and longevity-inspired patterns like I'm sure a lot of you have heard of the blue zones. Where are people living the longest? Why are they living there? What sort of lifestyle habits and patterns can we learn from these people to integrate into our lives today, here, where we live, in our own environment? And we integrate sleep, we integrate stress regulation, movement, interpersonal relations. And I take it a step further and I look at toxin exposure, not just tobacco, alcohol, and drugs, but what are the products that we're exposed to on a regular basis, like our cookware, like our deodorant, like our household cleaners? Not trying to raise panic, but trying to raise awareness, because as I see it, this is an environmental soup of sorts, and each is a critical component of the wellness picture. Each one depends on the other. And for sustainable results, each component needs to be fully evaluated, nurtured, and optimized. So this approach is designed for people who want to address root causes, people who are tired of temporary fixes, chasing short-term results, who want to feel better, who want sustainable, enjoyable weight loss, more energy, lower inflammation, and reduce long-term disease risk. It's really focused on balance, happiness, and longevity for people who want to reduce their dependence on reactive care and build proactive health. This is the work. And I do believe that medication absolutely has its place, because people will ask me that, but lifestyle is the foundation. Even if I'm prescribing a statin for a patient with high cholesterol, we're still going to talk about lifestyle. The patient might need medicine, but you have to focus on the lifestyle as the foundation there. And when we strengthen the foundation, everything else works better. So let me show you 3 examples of what this looks like in practice, how we target the root cause using food. Think of these as food as medicine tools to improve your metabolic stability, to lower your inflammatory signaling and regulate appetite, that you can start using today to jumpstart your journey to whole health. So the first one is avoid isolated carbohydrates. Don't eat naked carbs is what I say, because many of us are eating carbs in isolation. Toast alone, cereal alone, bagels, pasta heavy meals. When refined carbs, especially when carbohydrates, especially refined carbs, simple sugars, your white bread, your white rice, your white pasta, when these things are eaten without protein, without fiber, or without fat, they digest rapidly, and that causes a spike in your blood glucose. Your pancreas, sitting right here, says, I need to get this sugar out of the bloodstream. It responds by releasing the insulin. That's going to move the glucose into your cells, but it's also promoting fat storage. So all these spikes and crashes, frequent spikes are increasing your cravings. They're increasing that feeling where, after you eat, you just feel so fatigued and lethargic. And they're also increasing that inflammatory signaling. When you take your carbohydrates and you pair them with protein, with fiber, or healthy fats, it slows the digestion. It blunts the blood sugar spike. It lowers the insulin demand, and it supports hormonal balance. So an example, instead of just toast, add an egg and some avocado, or add an egg and some greens on top. Instead of just having plain oatmeal, add a dollop of Greek yogurt, add some berries, add some nuts. It sounds simple, but these simple shifts help regulate your appetite, help stabilize your energy, and reduce cravings, all while working with your physiology. I see these as positive prescriptions for your health. What can we do to add in to promote nourishment and satiety versus a negative prescription? Like, what do we need to eliminate? What do we need to subtract? Number 2, include a solid protein source at every meal. If you're constantly hungry or thinking about food, protein is often what's missing. It's not just another macronutrient, it is very hormonally powerful. When you eat protein, your body releases hormones like GLP-1, which I'm sure you've heard about, Wegovy, Ozempic. You can leverage the power of your internal pharmacy, your internal GLP-1 by eating protein. So when you eat protein, your body releases GLP-1, it releases PYY. That tells your brain, I'm full, and it slows gastric emptying so you stay satisfied longer. That's why meals without protein, a salad with, I don't know, cucumbers and tomatoes and broccoli, or pasta without protein, just pasta with some basil, or just cereal, they leave you hungry soon after. Protein also supports your muscle maintenance. It's critical for metabolism and insulin sense. It's critical for your metabolism and for your insulin sensitivity. So muscle is metabolically active tissue. When you preserve it, your body does a better job of processing glucose and burning fat. Without enough protein over time, especially in adults who are in strength training, and also peri and postmenopausal females who are at risk for sarcopenia, that's muscle loss, the body has a harder time maintaining that muscle, which can affect your energy, it can affect your metabolism, and even your cravings. So I tell my clients, like, you have to include a solid protein source at every meal. That's going to calm your hunger. That's going to reduce your cravings. It's going to stabilize your blood sugar. It's going to support your metabolic hormones. Some practical examples: plain Greek yogurt, chicken, fish, tofu, beans, lentils, even your snacks. You can upgrade those with protein. Have a hard-boiled egg, have nuts, have Greek yogurt instead of carb-only options. It's a simple shift, but it's one of the most physiologically powerful ways to regulate appetite and metabolism. And it works naturally with your body. The third thing, add fiber at every meal. Fiber is one of the most powerful nutrients for metabolic health, and most adults are severely under-consuming fiber. Soluble fiber, it slows the absorption of glucose in your small intestine. It literally creates like a lattice structure there to slow the absorption. It helps to blunt the blood sugar spikes and reduces insulin demand. That keeps your energy steadier and reduces inflammatory signaling in your body. Fiber also feeds your gut microbiome. So when the gut bacteria ferment fiber, they produce short-chain fatty acids. These aren't just for gut health. They help improve your insulin sensitivity. They help lower inflammation and even influence your appetite regulation. So increasing fiber at meals also helps you feel fuller longer. Think of your vegetables, your beans, your lentils, your seeds, and whole grains like farro, like bulgur, quinoa. They all contribute. Even small additions like adding beans to a salad or chia seeds to your yogurt, they can have a powerful effect. Fiber supports your blood sugar control. It helps support your satiety and lowers your inflammation all at once. So I like to think of it as like metabolic medicine that you can actually eat. So now I want to show you what this looks like in practice in real life. Talk to you about one of my clients. This is Cheryl. She's a busy realtor with an unpredictable schedule. And when she came to me, she was concerned about her blood pressure, which had been trending upwards around 138/77, as well as her hemoglobin A1C, which was almost in the diabetes range at 6.4. So hemoglobin, so we talk about, you can check a fasting blood sugar, which is a snapshot of your blood sugar at that moment in time, or we look at hemoglobin A1C, which is an average of your blood sugar over 3 months. We use this to help us make a diagnosis of prediabetes or diabetes, or to monitor our diabetic patients on their medication their adherence to medication and how well they're doing on their medication. So it just helps us see like a bigger picture. 5.8 to 6.5 is pre-diabetic range, and 6.5 and higher is a diagnosis of diabetes. So that she came to me at 6.4, so almost 6.5. Being in the pre-diabetic range too, I tell my clients, it's the perfect time to jump in and make lifestyle shifts to prevent the onset of type 2 diabetes. If you do nothing in pre-diabetes, in 5 years, the data shows us that will advance to type 2 diabetes. So she was feeling uncomfortable with her weight. She was wanting to lose the weight she'd been holding on to for years in a sustainable way. And her ultimate goal was to prevent progression of disease and live a long, high quality of life for her daughter and for her puppy, to be able to be active, to be well in later life. And she made it very clear to me that she does not love to cook. So through our work together, we focused on simple, delicious anti-inflammatory meals, on upgrading the nutrients in her meals, basically positive prescriptions for health, healthy and nutrient-dense recipes, refined carbohydrate swaps, the strategic use of spices to replace sodium, and a sustainable, non-extreme movement plan that she actually enjoyed, as well as mindfulness and simple stress reduction methods to lower cortisol. In just 2 months, 12 pounds came off, and her hemoglobin A1C trended in the right direction. It had been trending upwards for a while. So it was down to 6.1, not out of the prediabetes range, but coming down. Her blood pressure normalized to 116/68, and her energy improved significantly. And her plantar fasciitis pain resolved. And if anybody knows, it's very painful. It's like there's a plantar fascia under your feet. When you wake up in the morning, it's very painful. It's hard to walk. It just makes you miserable. So we were really excited that resolved. And the best part was that she had this revamped relationship with cooking, viewing it now as a powerful tool for wellness, that she doesn't have to slave away in the kitchen to have a nourishing meal aligned with her goals. So as simple as having just a few nutrient-rich ingredients stocked in her kitchen and a go-to strategy to have a healthy and delicious meal ready in under 15 minutes that was aligned with her health and wellness goals. So I'm really, really proud of her. This is another powerful transformation I want to share with you, one that really reflects how much is possible when we approach health with structure, with compassion, and a focus on progress, not looking at being perfect all the time. So Sarah's a busy lawyer. She's a teacher. She's a mom of 2, and someone like so many had spent years trying to get back on track, only to feel stuck in the same cycle. Lose a few pounds, gain it back, plus some, and then feel ashamed and start again. And when she came to me, she felt completely defeated by sugar cravings, by low motivation, this exhausting cycle of I'll start Monday. She was avoiding workouts. She felt uncomfortable in her clothes. And she had told me that she felt unmotivated because she didn't know where to start or how much to change. It was just all really overwhelming for her. She felt bad about the weight she had gained since having kids, and really critical of herself every time she lost them and put it back on. And she would tell me that summer was really hard, bringing up a lot of anxiety at pool parties, walks, beach days. These are like times that should have been joyful for her, but she was feeling stressed out instead. She told me she wanted to be a good mom, a good role model for her kids, not let her swimsuit aversion get in the way of her summer fun. But neither of these options, hiding or showing up, felt good. It didn't feel like she was being kind to herself. So when we started our work together, we didn't overhaul her life. We focused on the ENSO method structure using small, sustainable changes: blood sugar balance, satisfying anti-inflammatory meals, having protein and fiber at every meal, simple mindset shifts that helped her let go of the all or nothing mentality that had really tripped her up for years. So just focusing on progress, not being perfect, not counting calories, not weighing food, not extremes. And in under 2 months, she lost 11 pounds. She started fitting into her old clothes again, feeling more energized than she had. Very important. She felt proud of how she was showing up for herself and for her kids. And she felt her brain fog lifted. She didn't get sick for months, even working around kids daily. Other things she told me, she watched her family eat pizza without feeling triggered or deprived. And I just want to share this. It's not about being perfect. It's about aligning your purpose with the process. It's not about restricting. It's about having structure, about having compassion for yourself and sustainability, giving your body what it actually needs to be nourished and to be happy. So one of the things I realized early on in building my practice is that I can't work with everyone one-on-one, and I didn't want access to the science to be limited to private clients. So I created the Enso Kitchen System. This is my total evidence-based food as medicine framework, and it's designed specifically for busy humans and their families. It's not intended to be complicated. It's very simple. It's not restrictive. It's not for like people who love to cook, chefs. It's not, it's meant to be strategic. It's meant to be actionable and genuinely delicious. And it's built around anti-inflammatory recipes with structured guidance and strategies to help you boost your energy, to lower inflammation, to balance your blood sugar, and to lose weight naturally. It's definitely not for you if you're looking to measure every gram of food or count every step or really look at your calories. It's a system built on sustainability and enjoyment. It's a plan for life. Because in my opinion, if you can't see yourself doing something 5 years from now, it's not the right strategy. And that's the philosophy behind everything that I teach. I want you to be like my 100-year-old patient. I want this for you, and I want this for all of my patients and clients, not polypharmacy, not managing 10 medications, maybe on 1 or 2 meds, maybe for high blood pressure or elevated cholesterol, coming to see me once or twice a year, not cycling in and out of the ER, not overwhelmed by chronic illness, coming in for acute care visits, maybe some knee pain, maybe a sore throat, or preventative care, or follow up for your blood pressure. That's what I want for you and for all of my patients and clients. It's a long life, a high quality of life, a medication minimized life, and a life where you feel strong in your body. But here's what I've learned. You don't get there just by knowing what to do. You get there by aligning your purpose with your method. Because when people try to change their health without connecting it to something deeper, they burn out. They start off strong, and then it just doesn't work. They start again. But when you connect your health behaviors to your purpose, whatever that is, whether it's your kids, whether it's your partner, your vitality, your future, your ability to travel, to hike, to dance, to think clearly at 85, everything changes. And that's what the Enso method does. It's designed to connect your science with the strategy, with the purpose. So you don't just achieve your goals, you keep them up, you sustain them, and you actually enjoy the journey. On the days that I feel overwhelmed, I try to remember and connect back to my own purpose. So through my work at Enso Lifestyle, my goal and my hope is to get all of the incredible humans that I connect with and that I touch to realize their inner potential and help them connect their purpose to their ultimate goals. Whether or not you decide to join us in the Enso Kitchen System, I'm committed to helping you practice food as medicine. If today's webinar resonated with you, I share very frequently on social media, almost daily on Instagram and Facebook. I try to share actionable lifestyle medicine tools. I try to share easy things that you can implement right away, anti-inflammatory recipes that are delicious. I try to share sustainable weight loss strategies to help you optimize your long-term health. We've built an amazing community of over 100,000 people who care about doing this in a science-backed, sustainable way. And I'd love to have you join us. You can search my name or you can grab your phone and follow along. And if you're interested in learning more about my private lifestyle coaching practice, Enso Lifestyle Health, you can visit ensolifestylehealth.com. Thank you so much, everyone.
Thank you, Solmaz. Does anyone have any questions or comments? We still have some time left with Dr. Solmaz.
And you can also email me if you have a question. I'm happy to give my email if you don't feel comfortable asking it. I'm fine with that.
I'll ask a couple questions if nothing's coming in from the rest of the group.
Sure.
And you can kind of take your time or figure out the best way to answer these. Number one is sort of menopausal women, right? What do you see are kind of the primary things to pay attention to? And then number two, people who are potentially approaching, like a Alzheimer's diagnosis or something like that. Do you have any programs that would help with their diets, etc.? I mean, I know that's like a tough one, but is there any evidence in terms sort of slowing the progress of that disease, or what are your thoughts?
Those are great questions, Catherine. So for menopause, there's too much to say, but I'm going to talk about some things. So for menopausal women, they're amazing questions. There's there needs to be a very strong focus on bone and muscle health. I mean, there's so many things that we need to talk about: cardiovascular disease, risk reduction. I mean, neurocognitive health. But what's one of the things that we can just impact starting today? That's bone health, muscle health. So we really need to focus. So I'll tell my peri and postmenopausal patients, like, you need to be getting enough calcium in your diet. Okay. So whether you're perimenopausal, postmenopausal females, I'm not acting as anyone's doctor today, but I'm giving you the rec. So 1,200 milligrams of calcium daily, very hard to get from your diet, very hard to get from your diet if you're just doing food first. So talk to your doctor about supplementing your diet with a calcium supplement. You don't want to get all of it in supplement form, because there has been some data suggesting that all of the supplementation can create cardiac risk. So maybe 500, maybe 650 milligrams of that, and then getting the rest of it. I did create a smoothie that gives you 1,200 milligrams, but you might be, I don't know if you can eat for the rest. It's very filling. And just to give people, this is what 1,200 milligrams of calcium looks like. But you need adequate vitamin D levels in order to absorb calcium. So what are your vitamin D levels? Because if your vitamin D is like 5, we live in New England. Well, not everybody here, but it's dark all the time. Most people are vitamin D deficient. You got to stay on top of your vitamin D levels to make sure that you're able to absorb calcium effectively and efficiently. And you need to have weight-bearing exercise. Everybody's wearing the weight. You don't have to wear a weighted vest. You need to walk regularly. You do need to do some form of weights. It doesn't have to be heavy lifting, but all of these are important for your bone health, for your muscle health. DEXA, like postmenopause, I have patients who come to me and they're like, they haven't had a DEXA done. Like, what is your bone density? And then, very important to have a relationship with your primary care doctor that you really feel comfortable discussing everything. Like, a lot of people are scared to take Fosamax, or they're scared to do infusions for osteoporosis. Like, what are other options? What can we do? I mean, I feel very strongly about treatment for osteoporosis, but what I mean is you have to have an open dialogue with your doctor about these things so that you feel comfortable to voice your concerns. You're supposed to be on the same team and you're working towards a common goal, which is your overall health. So bone health, muscle health, I think we severely underestimate sort of strength training. I think, cardio is very important. Yes, you have to be walking, you have to be moving, however it is that you like to. You want to dance, that's great. You want to do Peloton, that's great. You want to do treadmill, whatever it is that you like. You want to go hiking, that's great. But strength training needs to be part of it, because you need to, muscle mass severely declines post-menopause. You need to make sure that is top of mind, that your strength, I would say at least 2, goal 3 times a day, rotating the muscle groups so that you're not just doing the same muscle groups over and over. You need to engage different muscles, core, arms, legs. So these are very important, important points for postmenopausal, perimenopausal females, but also cardiovascular. You need to talk to your doctor about evaluating what is we use the ASCVD risk calculator to determine, do you need to be on a statin? Do we need to be, how aggressive do we need to be about treating your LDL if your LDL is creeping up? How do we boost your HDL? The LDL is the bad cholesterol, the one that creates plaques, the one that causes stroke, that causes heart attack. How do we employ food as medicine to lower your LDL and boost your HDL? That's the high density lipoprotein. That's the good one, the one that comes and cleans out the plaque. So just great question, Catherine. Just so much to say on it that I could talk for like 2 more hours. But the neurodegenerative question, the Alzheimer's diagnosis, great question. And I am working with a few people actually right now who are it's either in their family or I have somebody with a new early onset. And we're talking about, there are different types of diets, but those diets, some of the diets that have been, this is actually specifically Parkinson's. Let me back up. For Alzheimer's, it's the Mediterranean diet. The Mediterranean diet, an anti-inflammatory, whole food, plant-leaning approach to preventing progression of Alzheimer's disease. So really embracing your whole, your vegetables, your fruits. And a lot of people don't incorporate. And if I could give you one thing, it's like beans. Eat beans. They will increase your lifespan. Beans are amazing. So, really people eating healthy, but they're not incorporating enough beans in their diet. Fall in love with chili. Chili is great. If you don't like beans or you can't, that's a great thing to start eating on the regular. So, Fish. So salmon, a good omega-3 fatty acid, rich fish twice a week. Again, that's a whole nother conversation because you have to balance, like there's toxins in the fish too. So you don't want to be eating, I mean, I have a client eating fish 6 days a week. You don't want that. There's parabet PCBs, there's methylmercury, like, so twice a week to reap the benefits. There's plant-based sources of omega-3s too. You have chia seeds, flax seeds. So really, this is food as medicine to really balance it. You can't just, you know, you want to really look at all different food sources to optimize it. You don't want to just be like looking at 3 ingredients and just eat those on repeat. You have to really find a system. And spices, these are anti-inflammatory too. We severely underuse spices. Turmeric, got to pair it with black pepper to increase bioavailability. That's a great, powerful spice for like inflammatory conditions, which is most chronic conditions, like we're talking Alzheimer's, cardiovascular disease. Like use these spices, not, and I teach my clients too, like not in supplement form, but in learn how to use them in, you know, in your cooking, because it's delicious. And also the tongue tastes when something doesn't taste good. Like these pills, these supplements, they're not regulated. So you're taking these supplements and you could be taking something that's rancid or not good, you know, it's not effective. So you learn how to use the spices. You can see all my spices there on the slides. I mean, they're not mine, but I'm just really big on spices. So I hope that's helpful. I can talk to you more about it too. I don't know if can I see the question somewhere or?
Thurin, you're on mute.
I think all the snow shoveling recently has helped with the weight bearing exercise for sure.
That's a good point, Allison.
True.
So someone in the chat asked a question. She said, how can I determine how many grams of protein I should eat in one day?
Yeah, so that's a great question. So current recommendation is 0.8 to 1.5 grams per kilogram of body weight. That's not how I operate. If any of my clients are in the room right now, or if anybody's listed, like, you know, this is not my style to go and be like, you're going to calculate that. Like, but if you're looking at the recommendations, that's the recommendation. If you're somebody who's lifting a lot, you're on the higher end of that. And if you're somebody who's more sedentary, you're on the lower end. But I do think that our country has become obsessed with protein. I'm just saying, like, and this can actually lead to, again, negative health outcomes. We don't want to be eating more protein than we need. If you look at this more as like a lifestyle, an enjoyable lifestyle, like I'm going to wake up in the morning and I'm going to have an egg with cottage cheese. And at lunchtime, I'm going to make sure that I have maybe tofu or chickpeas and some chicken. I mean, you have to be intentional about it. Dinner, I'm going to have some salmon. I'm going to, you know, like you're going to get enough protein. Your snacks, you have protein, like you're going to be okay, unless you're telling me something about your health that I don't know, or you're like a bodybuilder and that's a totally different story. But, you know, those are the numbers if you want the exact numbers, but that's not how I teach my clients or patients. I hope that's helpful.
You know, when Starbucks has a protein coffee, it's definitely become like commercialized.
It's out of control, really. I mean, I think we should be talking more about fiber, honestly, because nobody's eating enough fiber. And fiber is, I mean, you know, we talk about like the perfect food, like an apple, or like, you know, just something that just nature gave to us. It's sugar, but it's packaged with the fiber. So it's just beautiful. You don't get that glycemic spike. You don't get it's still better to eat the apple with a little almond butter. Yes, if you're trying to like really optimize it. But some people will like juice the apple. I'm like, no, you know, you're taking away all the fiber, all the beneficial components that's actually helping you lose weight. It's helping your heart stay healthy. Don't get rid of those things. Those things are good for you. So even the peel, if you're washing it, it's an organic apple, you're washing it really well. And so, sorry, I digress. But
no, nothing to be sorry about. I think everyone feels that there's so much information about diets and juicers and all these things. It's hard to know which one is relevant for you and which one's not.
And every day there's a new trend. It's like, take a turmeric and ginger shot. And then, you know, people are coming in to see, you know, my husband will vouch for it too. Like, you know, people come in and see us and they'll be like, I have like my stomach's burning, and they have like gastroesophageal reflux now. It's like, you know, there has to be like, there's a good way to do things. You can enjoy spices without taking shots of turmeric in the morning and ginger. Like that's going to burn a hole in your stomach, especially if you're fasting, for example. So
Yeah. We have another question. Someone wrote, I just purchased your cookbook. Does it
oh,
include a
thank you.
sample schedule so you can balance food meals, as in not overdoing it with fish?
Yes, there are sample schedules at the end of it. And yes, that there are. And there's also strategy embedded into that will talk about those things. So, and if you have questions, you can reach out to me.
Solmaz, I just want to add something else before everybody jumps. I think women, right, we tend to be caregivers and sometimes we fall behind on our own care. Now we're talking about it more, which is great. And so we are trying to take more care of ourselves. And, we certainly talk about it at SMB and Green Bee because we're all female team and we're all about, powerful women. But there's one thing I think that we miss also is making sure that our partners are also maintaining their primary care schedule and those visits because we handle clients throughout their life, and as we said, their health impacts their wealth. And I've had a lot of conversations with men who are fathers who may need life insurance and will say, well, when was the last time you visited a primary care doctor? And if it's
100%.
over several years ago, I'm like, no one is going to insure you. Like, you need to go to the doctor. And
Yes.
so, and you need to have them pay attention to the things on their face and the skin things. And like, I
Yes.
think men historically, I shouldn't generalize, but I kind of am like, generally, they're not very good at that. And so I like to tell women, like, stay on top of if you have a male partner in
Yes.
particular, stay on top of them and their health.
Just to add another thing for us to do. But it's true. No, you're right, because it's true. Women are, just as a primary care doctor, I have from the experience of seeing, like a lot of times the woman brings her husband in with them to just for me to talk to, so like, that's like very common story. So, can you please tell him what sort of screening he need, even if they're not my patient or, like, okay, so this is what you need to colonoscopy. You haven't had your colonoscopy yet. You haven't had your skin check. You haven't had, you got to get the blood work done. Like these things need to happen. But yeah, absolutely. I 100% agree with that. Any other questions or?
Can we just go back to the Alzheimer's topic for a second? So I was reading, like my dad has this, and I have two sisters. We're always, my one sister's looking up stuff on the internet all the time. Well, maybe this is going on and that's going on. And I saw in one of the videos, it was talking about like calcium chloride, particular, I think was what they mentioned, but all these, various things that might be like sprayed on our vegetables and fruit that are not healthy. So do you advocate a lot of organic versus regular, or as far
Yes.
as like, even if you pick healthy things at the supermarket, sometimes they're not always healthy, is I guess what I'm
Yeah, no, it's a great question. I don't know the specific study that you're referring to. I would have to go look. But definitely, I advocate for organic versus conventional. But they're specific. I mean, if you don't have if you're not on a budget for anything, yeah, if you can just go buy everything organic. Most people have to sort of pick and choose, and there's certain foods that you should absolutely always get organic. That's actually in my Enso kitchen system. I can't remember everything off the top of my mind right now, but like some are things that people don't even think about, like coffee, heavily sprayed, tea, heavily sprayed. These are heavily sprayed crops. Like that's not even something that people think of generally. Like when I'm talking with my clients, like if you're not going to eat the skin, it's like a banana. You don't have to get that organic because you're taking the skin. If it's sprayed, it's like you're removing the skin, you're eating the inside of it. But like things that you're going to eat, like the berries, you're going to wash those and you're going to eat them. You're not removing skin. That's a good way to think about it. So, like, trying to think of like herbs, like those are directly, you're taking them and you're, so organic. So yes, I 100% agree with going with organic as much as you can, and specific foods definitely need to be I mean, I'm happy to like share the organic list that I have. I can't like regurgitate all of it right off the top of my head right now, but I think it's very important for overall health because these do disrupt hormones and they can eventually lead to cancer and heart disease and metabolic diseases and most likely, yes, Alzheimer's as well. I don't think that that is like the thing, but it's all environmental, agents that can create illness. If it's just making better choices, smaller, better. You don't have to. I tell people because people are like, oh my god, I have all this plastic stuff. What do I do? You don't have to like throw all your plastic away, but just start to make little changes. Like you have a cutting board that's plastic. They're like, are the microplastics going into my chicken? Well, just get rid of one cutting board, get a stainless steel cutting board, and then like you don't have to, go crazy all at once because that's very overwhelming and very stressful. Like I had that too. Like with my kids, we had a lot of plastic thing. Slowly, everything's changed to like stainless steel, water bottles or soup container. I mean, so hopefully that's helpful, but it's step by step. You don't want to overwhelm yourself with any of this.
Right. Well, thank you.
You're welcome.
We do have another question in the chat with 1 minute to spare. Brianna, you just made it. For women with bone loss or worried about bone loss, how would they balance the need for calcium in their diet with Mediterranean diet recommendations to not eat too much dairy?
So that's a great question. Let me make sure. It's a great question. Let me make sure I understand. So if you have osteopenia, are you talking about porosis or osteopenia? Or it's just
She just said bone loss or worried about bone loss.
worried about bone loss. So there are calcium's a great, is this somebody who, are you lactose into, do you not like dairy? Are you worried about dairy? Like what's the problem with the dairy? So
I love dairy.
hi.
I like eat so much cheese and yogurt and I love it. But I'm is that fine? Is that fine to do?
Yeah, that's a great question. Dairy, organic, always organic. So cottage cheese, Greek yogurt, organic. It's fine to have it on a daily basis. I think I know a lot of diets are like, you got to cut the dairy. You can't eat dairy every day. I think dairy is okay. I'm not saying to eat it for every single meal. You can have it on a daily basis though. But there are non-dairy containing sources of calcium. So salmon, so green leafy vegetables. There's other ways to get calcium in. It's not just dairy. Hopefully and I can share a good list with you.
Yeah.
Yeah, absolutely.
All right, we are up on time, 1:30 on the dot. Thank you again so much, Dr. Solmaz. Obviously, no one dropped off on the call, which is a first. So obviously you shared a lot of really great content. We will have a replay available for everybody if you just want to have this in your back pocket as a little refresher, if you wanted to share it with anyone in your friends and your family. Obviously, a lot of really great information here. So thank you all so much for coming. Thank you again, Dr. Solmaz.
Thank you for having me. Thank you. It was a pleasure being here, and I love talking to all of you. Thank you.
Thank you.
You.